My name is Dr. Mkoya, a chiropractor and a registered physiotherapist. Today, let's talk about knee pain. A knee is the joint between the thigh bone and the shin bone. Okay, and it has very many structures. That's why it's called a knee. Apart from the bones, there are also ligaments that connect the knee, the thigh bone to the knee. And in between, we also have interlocking structures. And on the side, we also have other ligaments, okay, and tendons. And in front and behind, there are also other tendons. And any of those injured can cause pain in the knee. Knee pain can be because of any of the injured structures, either on the outside or the ones that lock on the inside, or things we call meniscus, things we call the lateral ligaments, things we call the tendon. But any of those injured, you will get knee pain, and it can be very excruciating, can cause a lot of pain. Yeah, before we go to the x-ray, you need to know what caused the injury. You need to know where the force was from. Was it from behind? Was it from the front? Was it from the side? Was it from... Knowing that, then you can put the knee under what we call a stress test. A stress test, even before the x-ray, can give you a rough idea of what could have, which injury could be. Because you cannot have the whole structures, the whole ligaments, the whole tendons around the injury. Then there will be no knee. Okay, so you can isolate by doing what we call the stress test to know whether it's a ligament injury or whether it's a meniscal injury or whether it's a locking injury that's causing the knee pain. Treatment, it then depends on which structure of the knee is injured. If the ligaments on the side, and if they are injured, simple rest of about 6 to 8 weeks with a hinged knee brace would do. The ones that are interlocking in the knee, depending on the severity of the injury, some would require another rest of about 6 to 8 weeks with the brace, or if it's so severe, then you must do surgery. Okay? And meniscus, most of the time, those are the ones that are on the side because the two bones don't sit on each other. In between, there's a ligament that sits between the two to prevent. So, a meniscus, this. Any of this injured, most of the time, it requires surgery because they have poor blood supply. So, those ones might require surgical intervention. But any of these structures can be managed, and the player or the injured person can get back to shape in a period of time. Sometimes, if it's an accident, then it's something you cannot have prevented. But if it's a sports injury, people play for 45 minutes, for 1 hour. But what has been happening, building the muscles around the knee joint, stabilize the knee, and other structures around the knee would prevent an injury.